Hello and welcome everyone to this webinar where we'll be talking about a just transition to cleaner transport in the social care sector. My name is Sylvia Barrett. I'm Director of Policy and Campaigns at the Campaign for Better Transport, and I will be chairing the session today. I will be introducing our speakers in a minute. Just to introduce the topic today and who we are. For those of you who don't know Campaign for Better Transport, we are the national charity for sustainable transport. We promote greener transport options for everyone to be able to travel more sustainably. We're delighted to have partnered with Unison on this report on how we can ensure a just transition to cleaner transport for the social care sector, a sector where we have workers on low salaries and with very demanding schedules. So it presents a unique challenge to how we can transition this key sector to greener transport. What we'll be hearing today from Dr. Stephen Goss from Campaign for Better Transport, who will present the findings of the research. We'll hear a response from Gavin Edwards from Unison in terms of the requirements that are needed in the social care sector. Lisa Markham will be presenting the view of the social care sector, and she's who's employed in that sector herself. And finally, we'll hear from Stephen Goss from the think tank IPPR about the challenges that people in key sectors and those on low incomes face in terms of transitioning to greener transport. Just one more point before we go to the presentation. As I said, we are a charity, and today is the last day of the Big Gifts Green Week. This is a campaign where all donations made to Campaign for Better Transport and other charities will be match funded by the Big Gift. So if you're able to donate even a small amount, your donations will be doubled today. So please do that if you can. There will be a link posted in the chat. So without further ado, I will pass over to Stephen Goss. He will talk to us about our report and the findings in our report.
Thank you, Sylvia. Transport is the largest source of greenhouse gas emissions in the UK. Reaching net zero demands a major shift towards more sustainable cleaner vehicles. Each sector must contribute to the shift, and social care is no exception. Many care workers provide essential support in people's homes and depend heavily on personal vehicles to meet the demand of visiting multiple clients within tight timeframes. Often undervalued, overworked, and low-paid, care workers face significant challenges in accessing cleaner vehicles or switching to more sustainable forms of transport. Without targeted interventions, they are at particular risk of being adversely impacted by policies designed to decarbonise transport. Our report outlines the barriers care workers face and the solutions Campaign for Better Transport proposes for a just green transition. How do we come to the recommendations in this report? In the first place, we spoke directly to care workers. The report draws on a survey of over 1,600 Unison members working in the care sector. Responses from home care workers were then analysed separately and compared with the overall sample to identify specific challenges faced by this group. Two focus groups with Unison members were also held to gather more detailed qualitative insights. In addition to this primary research, the study includes review of existing research, government reports, and relevant case studies. So, what did we find? Well, home care workers face significant travel demands, often relying heavily on private cars due to variable schedules and long distances between clients. As you can see from this slide, the vast majority own a petrol or diesel car, with only 2% at the moment owning a hybrid or electric vehicle. 71% use their personal vehicles for work, compared to 64% across the wider care sector. Public transport is rarely an option, only 10% use it. Furthermore, travel costs are a major burden. 36% drive more than 400 miles a month, and over half spend more than £100 a month on fuel. Low pay, poor mileage reimbursement, often as little as 30p per mile, and inefficient staff scheduling worsen the strain. Inefficient staff allocation is a major problem in home care. Many employers assign carers to clients across wide geographic areas without considering proximity or logical routing. This inefficiency drives up mileage and increases financial strain through higher fuel and maintenance costs. It also means care workers often deliver rushed care with little time to build meaningful relationships with clients. A good example of a better approach comes from Wigan Council. In 2017, Wigan restructured how home care was delivered, working with providers to cluster services into smaller local districts. This reduced unnecessary driving, encouraged more active travel, and improved staff well-being. Wigan's model shows that smarter scheduling not only cuts emissions and transport costs, but also supports better quality care by giving workers more time with their clients. We therefore recommend adopting similar clustering initiatives across the country, which could transform the care sector, benefiting carers, service users, and the environment alike. Although there is interest in electric vehicles among home care workers, our research reveals a lot of skepticism. 47% said they would definitely or probably consider buying an EV in the future, but 33% said they would not, and 21% are undecided. Among those not considering an EV, 61% cited high purchase costs as the main reason, followed by concerns about poor charging infrastructure. Focus groups reflected this hesitation. Many carers were unaware that switching to an EV could save them around £520 per year on work-related fuel costs and nearly £1,000 a year across all driving if they can charge at home off-peak. Across the sector, that saving could total £7.5 billion annually. One solution to help home care workers shift to electric vehicles is a government-backed social leasing scheme, as proposed by Possible. Under this model, the government would act as a guarantor, helping high mileage carers lease EVs at low monthly costs, bundling insurance and maintenance, and offering flexible terms. 23% of surveyed home care workers said such a scheme would make them more likely to consider an EV. France's experience shows how successful this can be. Back in 2023, France launched a social leasing program offering EVs for 49 to 150 euros per month. It received over 90,000 applications, double the forecast, with beneficiaries mainly younger, low-income individuals, a clear sign of strong demand when barriers are removed. Another option is a vehicle scrappage scheme, similar to London's, where residents receive grants to scrap polluting vehicles. A targeted scheme for care workers could replace older, high-emission vehicles with cleaner options. And 23% of surveyed home care workers said this would make them more likely to switch to an EV as well. However, these incentives must be combined with better access to home and public charging networks. Rising fuel costs are already driving staff out of the sector, with nearly half of rural providers reporting workforce losses. Addressing transport costs would relieve financial pressure, improve staff retention, and accelerate the transition to net zero. Home care workers face high costs from owning and running cars, yet little has been done to help them share vehicles more efficiently. Car clubs and pooled fleets offer a solution, giving carers access to shared cars without the burden of ownership, with insurance, maintenance, and fuel included. Car clubs also have higher rates of EVs, helping workers try electric vehicles without the upfront costs of buying them. In Norfolk, a partnership between the NHS Trust, Knowles Fleet, and HireCar introduced a keyless car sharing system, boosting vehicle use by 60% and saving over £100,000 a year. Similarly, Siemens cut travel costs by 28% after switching to car clubs, and Tewkesbury Borough Council reduced its carbon emissions by over 4 tonnes in just 6 months. To make these schemes work for home carers, local authorities, care providers, and the government must collaborate in funding the infrastructure and helping to manage the membership schemes for care workers. Public transport remains underused. As I mentioned, only 10% of home care workers rely on it, compared to 15% across all carers. In our survey, just 9% said public transport could be a realistic alternative to driving. 41% cited reliability issues, and 32% pointed to lack of routes as key barriers. Focus group participants highlighted how buses are often unavailable during early mornings and late evenings, which are crucial working hours for carers. And as you can see from this slide, Other care workers shared additional problems that they have faced in using public transport. High costs were also a major factor, especially after the government's decision to raise the capped bus fares by 50% from £2 to £3. Ultimately, 35% of home care workers said that even with improvements, public transport would still not be a viable alternative to driving. Nonetheless, free or discounted fares are the most popular incentives to get home care workers using public transport. 38% said discounted passes would encourage them, and 27% would be more likely if fares were cheaper. Targeted free or discounted travel passes, especially in areas with existing good networks, could make public transport a realistic alternative to driving for many carers. Improving service frequency and reliability would make a real difference. Over a third of home care workers said better coordination would make them more likely to use buses, and there are successful schemes already in existence. First Bus's Commuter Travel Club offers 20% off passes, and NHS staff across England get similar discounts. Therefore, local authorities, care providers, and transport operators should collaborate to extend these types of schemes to home care workers nationwide, making public transport affordable, accessible, and truly viable. Cycling offers real benefits for home care workers, from lower travel costs and avoiding traffic to better health and reduced emissions. Yet it remains hugely underused, with only 2% currently cycling for work, and just 16% saying they would even consider it. Major barriers stand in the way, especially in rural and semi-rural areas where over half of the respondents to our survey live. A lack of safe cycling infrastructure, secure storage for bikes, and the physical demands of traditional cycling also deter many, especially older carers. To make cycling a viable option, we must address these infrastructure problems, the logistical issues, and the cultural challenges associated with cycling head on. Therefore, we are recommending that local authorities and care providers work with Active Travel England to provide free or subsidised e-bikes and cycling support for home care workers alongside investment in safe cycling infrastructure. Our survey shows 25% of carers would be more likely to cycle if offered free bikes or e-bikes. The focus groups highlight a particular interest in e-bikes, which reduce physical strain and enable faster travel. Smaller work zones would also encourage cycling. 24% said closer planned allocation would make it more feasible to travel by bike. Case studies such as Essex Pedal Power and NHS e-cargo bike trials show how free bikes, safe routes, secure storage, and on-road training can transform travel options for workers. Pilot projects in urban areas could lead the way, creating a blueprint for wider rollout across the country. In conclusion then, a just transition for home care workers is essential. These vital workers face huge transport and financial pressures every day. Supporting greener, more affordable travel isn't just a climate necessity, it's a moral imperative. Local tailored solutions like subsidised e-bikes, car clubs, public transport discounts, and smaller route planning can reduce costs, cut emissions, and improve care delivery. Crucially, they can also help retain staff in a sector already under immense strain. As one carer put it, carers are an amazing workforce, but the system needs to value us more. It's time we match their dedication with real support. Thank you.
Thank you very much, Stephen. So I guess in summary, what we're trying to do is to make sure that there are reforms to reduce the demand for travel overall for carers, while opening up options to travel by public transport, active travel, and moving to cleaner vehicles where this is not possible. So I think in our discussion, we can talk about whose role it is to deliver those changes. So, and for those of you who haven't seen the report, which we have launched today, the full report is available on our website, and I'm sure we'll put the link to the full report in the chat as well. So, Gavin Edwards is a social care lead at Unison. Thank you so much for supporting this report with us, and delighted to have you on the panel.
Thank you, Sylvia. I'm so pleased today to be welcoming this report on behalf of Unison. We're really pleased to have backed this piece of work social care is a major priority for Unison at the moment, and this is a really important strand of that work. Our starting point with social care is that it's a vital public service which is fundamentally broken, and pay is too low. Care workers are struggling to make ends meet. They're not paid enough for their travel time. As just one example, very few care workers have adequate sick pay. And unfortunately, there is a culture of driving down the terms and conditions of the care workers who provide this vital public service. And the outcome of this is that you have record vacancy rates and people not getting the care that they need. And at the heart of that system is a lack of coordination and political accountability. And I'm going to loop this back to the subject of this report in a moment, but I think this is important context for the things that we are discussing today. The social care sector in this country is built for buck passing. It's built for the local authorities can always say central government isn't giving them enough money. The providers of social care can always say that the local authorities are not giving them enough money through commissioning, and the government can always, if it wants to, and as it did often during the pandemic, unfortunately, blame the rest of the care sector. And one of the things that we're trying to do in our work in social care is to stop that buck passing. And that's why I think that having a system where there is political accountability for the care sector, not everything being run from Westminster, nobody's advocating for that, but making sure that the Secretary of State for Health and Social Care is as accountable for what happens in social care as they are for what happens in the NHS. And luckily now we've got a government that actually wants to take on that responsibility. And one of the drivers behind that, I think, is, of course, they want to see a much better functioning care sector, but they also can see how the problems in social care are seeping out into other areas, like the NHS, where it's boosting waiting lists, like the economy, where it's preventing people from either returning to the workforce or from entering the workforce in some cases. But and now we get back to the subject of today's webinar, it's also preventing us from fulfilling all that we might on tackling climate change and on making progress towards net zero. And I think that's one of the great things about this report, is how clearly it brings that link to the fore. So at the core of this argument is that we've got an inefficient, poorly funded and wasteful social care sector, unfortunately, and that's stopping us from taking forward some of those policies, and it's also making life more difficult for care workers. There's no greater threat and no greater challenge facing us at the moment than the threat posed to our planet, and social care has got to make its contribution, as Stephen said. So the changes happening in the care sector under the new government are going to make delivering the kind of policies that are recommended in this report much more easier to achieve. As you know, the government is committed to creating a national care service, which is currently asked Baroness Casey to develop recommendations on at the moment. But they are also getting on with the process of developing a fair pay agreement, which would be a national pay bargaining structure, but also a structure that could lend itself to helping with a national partnership working between unions, employers and government in delivering perhaps some of the policies that we've got on the table today as well, providing a structure, a model for doing it. As we sit here today, the government doesn't have the levers to achieve those things. I always think back to an example that was given by Wes Streeting, Secretary of State, recently after the election in a public event. And there was a problem in the care sector. He asked his civil servants, what could he do to sort it out? And they recommended to him that he write a letter. And his point being, he didn't have the levers to pull in order to deliver these things. But if we're looking at policies like better planning of calls, the clustering that Stephen was talking about, incentives to increase the use of electric vehicles, the coordination of increased use of public transport. This is going to need central government to take a more interventionist and active approach in the social care sector and to work with local government and providers as well. And that very much is with the grain of a national care service and a fair pay agreements. So not only do we not have enough care workers at the moment, we're going to need many, many more in the future. And that's a really strong part of this report as well. How not only will these changes make a positive contribution to tackling climate change, it will also make life easier for care workers and reduce some of the outgoings that unfortunately often fall upon them at the moment because of the wasteful way in which calls are planned and in which the ways in which people are forced to travel in order to do their job. So I will finish there. Really, really strong welcome from Unison, the largest union in the care sector, for this brilliant piece of work. We're so pleased to have worked with Campaign for Better Transport on this, and I'm really looking forward to the other contributions to today's event. I'll leave it there. Over to you, Sylvia.
Fantastic. Thank you so much, Gavin. I would now like to introduce Lisa Markham, who is a member of Unison's National Social Care Committee and also employed in the sector. Lisa would love to hear your reflections and also the experiences of yourself and your colleagues.
Okay, thank you very much. I'm really pleased to be listening to this and to be here today. So thank you very much for that opportunity. And I did just want to make clear that I am not an expert in green environmental issues. I'm a kind of jobbing person who's been around for a while and hopefully has got a bit of common sense and has been thinking about these issues for a while. It is the case that I currently work in the social care sector, in the adult social care sector particularly. I've done lots of different roles within public service, both for adults and children's services over the years, and some in a managerial and policy development capacity. I think importantly, and this was a kind of key moment or a key period in all sorts of ways, I worked through the pandemic as a personal assistant, which is a particular form of home care worker. And that's what I still do across a number of settings, predominantly with people with complex disabilities needing quite complex care. I'm also a long-term Unison member. I don't think Gavin realises that. I haven't always been active, but I'm delighted to be part of the Social Care Committee. And I actually have to say I'm really proud of the union's vociferous campaign to improve terms and conditions for this workforce and for the efforts made in bringing together the agreements about care and pay, yet to be tested, but ongoing. I'm also an optimist, so I was very encouraged, heartened, excited by what I heard Stephen say earlier on. So thank you, particularly Stephen. And I'm also an optimist about the current government, and I do think there is a sense of, for me, a shift of mood, attitude, those sorts of things. And I do believe that the government is taking a more active role than previous administrations to address the issues of adult social care. And I think there's a commitment here to starting to join up structural reforms, yes, but joining up the dots. And for me, making sense of this means allowing for the possibility that we have to do things differently, and we're joining up the dots. And that means taking the greening of social care really seriously too. And I say that because I've mentioned to a couple of people that I'm doing this seminar, and there's a kind of why then that question in the air. And actually, the work I do in community is about community. It's about people. It's about people's lives. And the issue about greening the sector is linked to the greening of the environment more widely and our planet. And it is ultimately about people. And I think it's really important, just in terms of my reflections, the people we serve are amongst the most vulnerable in the community. The pollution, climate change, extremes of temperature have already had an impact. Some of those people died because of compromised heart and chest and lungs during COVID. And importantly, some of our most disadvantaged care workers also died or experienced significant illness and disability during COVID. So it is all relevant to the wider picture about making the sector safe and for workers to have the right to be healthy and their well-being needs addressed at work. And I want to say, so this is a personal reflection, I'll try not to talk too long. The work can be exhausting physically, emotionally, particularly logistically and financially. You've already talked about the financial difficulties faced by some workers, so I won't repeat that. But I will share my experiences of seeing, because I work as a personal assistant and I have a degree of managerial responsibility in those roles. I've seen coming to houses teams of workers who've been racing round the city trying to get to places on time. I've seen unworthy vehicles, probably polluting vehicles and probably unsafe vehicles transporting those workers. And on the sharp end of that, I've also seen service users not get the right service at the end of that rushing round. And what's really important about the work we do is the relational work to support clients. You can't just go in and shove a tablet in somebody's mouth and then disappear. That's not what it's about. And even if I think about those cars that I've seen, I think then about the huge environmental impact and waste of time and resources. I think there's a bit of a myth that nobody's concerned about greening. I think that's wrong. And I think, without repeating, your report has evidenced very clearly the things that people want to do, but there are barriers to that. And I think for me, as a care worker who's relatively privileged because of my previous background, what I see is ongoing financial disadvantage for care workers across the sector, which makes all of those things that middle class England finds easy to access. So there's an equality and an equity issue here as well, whether it's around electric vehicles or access to charging points or whatever, or adaptations to your house, whatever. The other interesting thing is I'm mad keen on public transport, been involved in Better Buses in Sheffield, and it is only recently that light bulbs have gone off in people's heads about the fact that actually care workers are amongst that sector of people who work at nights, who respond to emergencies at unsocial hours, etc., etc., etc. So we absolutely have to see some improvements in the reliability of bus services. I think so. I want to repeat that point about the relevance of the greening social care agenda for well-being, and I would think safety, ease, comfort, a sense of being looked after, and also lives being financially more manageable. And I think it's really important that the voices you've shared within the report are heard, and that if you're listening today on that call, I think this is going to be taken really seriously, and I'm really glad that you've been listened to. You've already given us some facts and information, so I'm not going to repeat that. I just want to say that I have had a light bulb moment myself, even on this call. We've asked earlier on about, different ways of getting people to work. As Gavin will know, one of my pet themes is about the scheduling of work. I've seen some disastrous scheduling. Sometimes I schedule, but I don't do disastrous scheduling. I take account of the individual needs of the workforce, the clients, the group of people that need to be supported, and we work together on that. So it's very much a collective and collaborative approach. I personally, and I realised as Stephen was talking, I've been able to organise most of my work so that I can A, walk to work if I want, B, use a cycle. I'm not a very good cyclist. I only learned to ride 5 years ago after illness. But also, I don't have a car anymore. Why don't I have a car? Partly because it's the right thing to do, partly because I'm an older woman and an unpaid carer, and I don't have a huge amount of money. It's expensive to run a car, and I've realised I can manage without it. Everywhere else, I go by bus and train. So you asked a question about that, and I think I've started to live it without realising it. So maybe that's a bit more of the discussion. I think we need to aim high on this, because the report isn't just about greener transport, is it? It is about people's lives. And I suppose that's my starting point. This fits with I think someone used the word moral imperative. This fits with the moral imperative for workers to be treated kindly, respectfully, and with attention to their needs, as well as our obligation to ensure we provide the best possible support to those who need it. So thank you for listening, everybody. Thank you for being here. Thank you for all of what you do, Unison colleagues. Thank you for being a member of Unison. And there is a Get Active campaign right now if anybody wants to be more active in Unison. Thank you. I'll stop there. Thanks.
Thank you so much, Lisa, for painting that picture for us and for sharing your experiences. It's really helpful and amazing job. Just to remind the audience, if you've got any questions to the panel, please post them in the chat on the YouTube channel, and I will share them with speakers at the end of the discussion. So I'll make sure that there's plenty of time for questions. And Stephen Frost from IPPR, welcome, and thank you so much for being with us. Can you please tell us a little bit more of the research that you have been doing at IPPR on people on low incomes, and how what you've seen shared today relates to the wider sort of sector and other people employed in other key sectors and people on low incomes?
Thank you, Sylvia. I think some of that we might get into with the discussion as well, but I can give you kind of my initial reflections on the report and kind of where that sits within our wider work. And first, just to thank you for inviting me to come along today and giving me an early sight of the excellent report, and really delighted to hear kind of the optimism of Lisa and Gavin on kind of what might be possible now. But also, I don't think I could do a better description of describing why this matters than you've just provided, Lisa, both
Oh.
in terms of what it means to people on a day-to-day basis to be able to access the things that matter to them in a way that they choose and they feel like it's good for the planet, but also in reducing that exposure to harm, the kind of damage that highly polluting vehicles can cause. And I think you've just captured everything that is meant by a just transition and the opportunity of it in the most succinct way that I've heard recently. So thank you. I've gone away having kind of taken that optimism with me. My kind of 3 quick reflections on the report and the research and kind of the voicing that we're hearing from care workers as well is one, I think it is really positive to see that the report shows that this transition to greener transport is not about sacrifices and asking people to bear additional costs in their lives. It is in fact this really big opportunity to rethink how services are designed and kind of the benefits that can come from that, but also just simply make transport work better for people, saving them a bit of money, improving their health, and just making it easier to get through all the things that modern life throws at us. There, looking after the kids, getting to work, doing the shopping, all of these things. Transport should be an enabler of these things, and it shouldn't be seen as a barrier that takes away your ability to enjoy these. I think it's also clear to see that those benefits that could come from this transition can't be taken for granted, that the only way that you get there is by really understanding the needs of people who are on a low income or care workers and haven't been prioritised in the past within transport policy. If we don't have that perspective within our work, then we will see a widening of transport inequality with those who already have access to EVs and great public transport, all these things, kind of getting more from that, but communities left behind and left kind of dependent on the costly fossil fuel cars that they are today. I'd say definitely the things that I've heard and seen in the report reflect more broadly what we see through IPPR's own surveying and public engagement work, that those who live on a low income get a pretty bad deal from the transport system as it stands today. And the British public are broadly aware of that, and they see it as an issue that needs addressing. We did a recent national survey, public opinion survey, where we asked which groups do people think get a good or bad deal from transport today? One of those big, broad questions. But the 3 groups named as getting the worst deal were those living in rural areas, those on a low income, and disabled people, reflecting what we've also heard in focus groups, that it feels like transport has not been designed with the needs of those people in mind. For those living in rural areas, it is expected largely that you'll get around with your car. And the needs of those who don't have a car or for whom a car is too expensive are not really accommodated for. And for those on a low income, they simply can't afford kind of access to transport. And for those with disability, there's another layer of barriers that transport can create to achieving what you want to on transport. And it's also clear that the experience of those on a low income kind of within transport is exacerbated by the cost of living crisis, that the cost of living it comes up as the top issue facing the country in national opinion survey after national opinion survey, and its impact can be seen in those statistics as well, where 1 in 5 people are actively worried about transport costs, and 7 in 10, around 70% of people, have made changes to how they travel to reduce costs over the last 2 years. So that wider context of things feeling more expensive, incomes not keeping pace with the rising cost of living, is being seen in how people experience transport as well. And beyond costing more, and I think we've touched on this already within your comments, Lisa, is that poor transport kind of being available to people also can cause stress, it impacts on health, on well-being, and simply just adds time pressure to people's lives. And my final reflection really is within the report. I think it's clear that we have many of the solutions needed to do this. And in truth, we've probably had many of them for quite a long time. It's just giving it the focus that is required and having political will and the right levers available to different kind of actors to make these changes. We've conducted various citizens' juries and panels on a fair transition for transport, and many of the policies put forward within Campaign for Better Transport's report reflect what we've heard, both from people who are living on a low income, but also from wider communities who want to see many of these benefits in their local areas. And the principles that we've heard time and time again is we need to see climate policies that are commensurate to the challenge we face, a collective challenge that we face, and the impacts that could be caused if we fail to mitigate the impact of climate change. And we also want to see policies that are effective and fair and take into account the starting place of different people across the country. And kind of care workers, I think, are a really good example of a group of people who are overlooked time and time again within those kind of national transport decision-making frameworks and could be served so much better by transport policy. I would also say within Campaign for Better Transport's kind of framing of the policy asks is you see a really good kind of mirroring of the approach taken at an international level to understanding how we should approach transport decarbonisation, with a framework put forward by the Intergovernmental Panel on Climate Change to avoid, shift and improve. Avoid the need for travel where we can, make the shift to non-motorised transport where that's possible, and then provide fair access to improved journeys through electric vehicles where you still need to make those journeys in an efficient way. And I think I would just wrap up on a final thought, which I think is basically everything Lisa said in her own comments, which is why I think this research is so important and the value it adds to kind of wider transport decision making is that point on the benefits of greener transport will only be fairly shared, and we can only secure a just transition for transport if we understand the needs of different groups, including those on low incomes and care workers, and involve them actively in decision making and explicitly prioritise them within transport policy and investment decisions. And we need all of that to kind of secure the kind of benefits that we can see in front of us, I think.
Thank you for that, Stephen. And yes, indeed, with this report, we really wanted to highlight the needs and views of care workers and how really those need to be taken into account if we are to make that sort of progress and bring people along on that transition. While we are waiting for questions to come from the audience, I would like to ask speakers about your views on how the requirements for home care workers differ from those for the wider care sector. So I think what we found in the report is that there's obviously much more demand for traveling between the people that carers look after. Stephen Goss, could you just elaborate a little bit more on those findings in the differences between the wider care sector and home care workers?
Well, yes, one of the big distinctions, of course, is that home care workers have to travel around various different locations over the course of the day, whereas for most other care workers, it's generally a fixed location where they have to travel to and from for work purposes. So as you can imagine, then the distances being traveled by home care workers over a monthly basis was considerably higher than for other care workers, and therefore their expenses were considerably higher as well. So that was a noticeable distinction. And also, of course, that difference shapes the responses as well. So it might be possible with better bus services to encourage more care workers generally to travel by bus to their place of work. But as we found with the study and report, if you are traveling around all day between different clients, you cannot rely on buses at the moment. So a big part of what we're proposing with the report is that the recommendations that we've made are not all or nothing. So the idea is that what we have suggested are a range of things that can be used for different aspects of care, the care sector, and by different elements within it in order to achieve that that transition and also to make their lives easier and more cost effective.
Thank you. I guess because of that requirement to travel more, there is frequently a requirement on carers to own a car to hold a driving license. We've obviously made the recommendations about clustering and scheduling better. Do you think this will help, Lisa? Do we need more and sort of wider cultural change around the demands on care workers? You're on mute, Lisa, sorry.
Sorry. Yes, I think we probably do. And I suspect that it may be, I'm not certain, but it may be standard across all care role job descriptions that people can drive. So there is an issue about how we kind of target more carefully and make more specific and focused support plans for people who don't need, who might need longer sessions, or and where people don't need to drive. It's a big question. I think there are all sorts of other consequences of us relying too much on care, which impact on service, or on cars, which impact on service users. I think about, really bad parking. I think about blocked access and all of those sorts of things, which you almost see everywhere now. But I certainly think there is room within the range of home support provision, particularly, to think about your targeted recruitment processes and sometimes taking out the requirement to be a driver, because lots of the jobs that some of the people I work with do can be done without having a driving license. It's also quite discriminatory and all of those sorts of things. I mean, if you need to support people with adapted vehicles, you will need a driving license. There are some people we support who cannot access public transport with dignity and safely and comfortably, but that's a relatively small workforce. So I think it's about challenging some of the assumptions. Obviously, it links also to scheduling, because again, I think about the locality where I'm involved now. You could, on certain bus routes, get to anywhere on that patch without needing your car. So, but if you were doing that night work, that would be more difficult, though there's something about the different patternings of public transport. The other thing is, I've just begun to explore some car sharing schemes, and I think that was talked about in the report. Some people are reluctant at certain times of day or night not to be in a vehicle because of safety issue, especially for women staff. We've done some work around women in transport. That is an issue. So we maybe need to say, here's another opportunity to have a shared agreement about getting to it if you absolutely have to have a vehicle. But now I think about it, I looked at some application forms for the residential sector. Most residential sector people don't need a car at work, so they should be able to organise things like a residential sector car hire arrangement. That's a long-winded way of responding. Sorry to go on about that. You've made me think today much more about that question. Thank you.
Absolutely, very helpful. And you mentioned, Lisa, that it can be discriminatory. I'm thinking particularly with younger people being less likely to hold a driving license than, I guess, previous generations. That can be quite a challenge.
I think that's right. And actually, at the same time, on some of the work we're doing in adult social care, we're actually trying to encourage younger people to consider care as a respectable, progressive career that is of great benefit to them and the community. So we are actively encouraging young people to come into the sector. So we have to look at that issue as well. Yeah.
And Gavin, is this a barrier to people entering the sector? Or are there any sort of other recruitment and retention issues? And what can employers do in order to reduce that over-reliance on cars?
I think, are these things barriers? I think they absolutely are. I mean, I hear from employers all the time. Obviously, we're in discussions with them quite regularly at the moment about national policies. And I hear from them that their frustration about an inability to recruit amongst younger workers. And that's something that different people will repeat at different events. So it's definitely a live issue. And I think the thing Lisa said just then is absolutely right. Is with domiciliary care, we shouldn't necessarily be placing an expectation on people that they should have a driving license, that they must have purchased their own car, that they, all of the things that come with that. Leaving aside the environmental impact of all of those things, the financial impact of that is actually very significant. And many young people simply will not have access to the resources that enable them to do that, and will have access to roles and jobs in other sectors which are not placing those requirements on them. And so, there is an employment market argument here as well, is that many of those younger workers, but workers of other ages as well, are choosing to go and work in, I think, perhaps less rewarding roles in other parts of the economy, but roles that don't place the same financial burdens upon them. And I think that's one of the things that the government needs to think about, and the employers need to think about as well, is if we can start to shift around that financial balance. Actually, there is a very strong argument for, as Lisa says, younger people going into social care as a career for the long term, which I think that would have many, many benefits in lots of different ways. But at the moment, they're simply not able to make that choice. And I think that goes back to some of the points that Stephen was making about the cost of living as well. The challenges of making ends meet are simply too great at the moment. So anything we can do to help address that is going to make a positive impact.
And Stephen Frost, we heard that, I mean, obviously to us, it's not an all or nothing approach, as Stephen said, and we would like to see improvements to public transport to make it more accessible to more people who could use that on a day-to-day basis, and also enable access to electric vehicles, to cleaner cars.
Mm-hmm.
But many people, obviously on low incomes, don't see that as an option to them currently. What are your views on the priorities between different options, specifically for people on low incomes?
It's really difficult to put one above the other when you're working transport. They sit so kind of closely together because they serve different needs to different groups. If you are living on a low income in kind of care working role in a city, then public transport should be meeting so many of your needs and designing around kind of making it possible to live without a car and access the kind of things that you'd want to do on a day-to-day basis. Offers so many opportunities to save money, to improve your health, all of those things as well. So it's clearly fundamental to that. If you take that view out to some more rural areas where existing bus provision is already so limited, the ability to get that public transport system up to the level that it's going to be able to do all of that, it's going to take time, money, a lot of political effort to get there. And electric vehicles offer a really good way of saving some money in the meantime, and giving people a more reliable journey. And I think that's where the kind of really targeted view on, well, what are we talking about here when we're talking about access to an electric vehicle? Is it about owning a car in the traditional sense that we've seen before, or is it about providing the most affordable access that you can to a shared car? And that might be through, as we've talked here, kind of the role of employers in enabling some of that. It could also be kind of reimagining community transport associations and kind of what services they help provide, and more community-based kind of services and support. And I think we do need to be looking at both. Where we hope is in the long term, things like the zero emission vehicle mandate and the government's approach to banning fossil fueled cars, kind of in the near future, will lead to more affordable electric vehicles coming onto the market, and then onto the second-hand market, which in reality is where most of us get our cars anyway. And so we should see those benefits. But I think we would have got the transition wrong if in the meantime we haven't seen EVs in the hands of those who could really stand to gain from their use. So a lot of my time is spent on the public transport angle on that, and also the active travel are kind of opportunities to break kind of car dependency. But I'm always really clear-sighted that you can't disentangle that from what we really want a transport system to look like around kind of those with these needs.
Yes, and thank you for mentioning the car sharing options as well, because car clubs and shared car fleets tend to be much cleaner vehicles compared to the overall fleets, don't they? So I think it's very important, and there's a role for employers there to seek out shared solutions for their fleets, but also for local authorities to see those as an option within the broader mix of transport offer. And I guess the question here is that there's quite a few reforms happening alongside in the transport sector, as well as in the wider public services sectors as well. We've got the government looking at an integrated national transport strategy, which we're expecting later in the autumn. But at the same time, we have devolution and local government reorganization reform happening. So the shape of authorities that we have at the moment and commissioning bodies for social care will likely change in the future as well. Gavin, did you want to comment on those sort of competing priorities and reform agendas, perhaps?
Yeah, I mean, I guess in keeping with the optimistic tone of this webinar, and I don't think we should make any apology for that, because I think looking to the horizon and seeking to offer practical solutions that will help solve some of these problems is the right approach. And I think the fact that these new strategies are coming to the fore, that there will be reorganisations in the commissioning bodies in social care, that the Fair Pay Agreement is being sorted out at the moment via the Employment Rights Bill, and that the government is committed to a National Care Service. All of those things provide a huge scale of opportunity that simply would not be present without a programme of reform. And so we're often left in a position where, okay, actually, what we need to do is help shape these reforms and nudge them in the right direction. And I think today's report is a very good example of that, is that we're not asking people to reinvent the wheel here. We're actually pushing with the grain of government reform, which is to seek to be more interventionist and to seek to encourage commissioning bodies and other local authorities to do more to benefit the kind of policies that we've been talking about today, and make sure that social care can have its contribution to a just transition as well. And I think that we should take those opportunities. And I think what we will find is that across the table from us, metaphorically speaking, but sometimes actually, is ministers and decision makers who are actually open to those discussions, and maybe that's not been the case for quite a considerable amount of time, and I think it is the case now, and that's probably why we should be optimistic about change.
Absolutely. So I guess what I'm hearing is that it's the right direction of travel and
Yes.
reform, but there's a lot of pressure on getting this right.
Indeed.
Lisa, what is your top ask for employers? Would you say what can employers do better to support their workforce?
I think there are a lot of things that they could do, but specifically there are a lot of not very good employers in the small, independent and private sector, smaller private sector. I think in relation to this issue, I would like them to facilitate more discussions about how people get to work and what impact that's having. So I'd like some really small scale listening exercises and talking exercises. And I would like people, I would also like, because this is one of the things that's been said to me, I would like a re-look at existing rates for travel expenses, which are really low across the piece. But I actually think there's a need for some discussion with both employers, and maybe there's organisations that support some of the home care sector. So, for example, we've got a PA network in Sheffield, which actually with some people who came from Wigan who probably were involved in the setting up the project that was highlighted. So some discussions with influencers in the sector who come with a different voice to be involved in those conversations. And I think they are things that people like me could just get on and start doing, to be honest. So not a very grand answer, I'm afraid, but practical.
Thank you, absolutely, and that's very important. Now, I understand we have no questions in the chat, so I think that's covered all the questions I had, but I would like to open again to all the speakers for any final remarks, anything that I haven't asked or you wanted to cover, and your top ask for people on this chat, maybe something that we can all do, but also what you would like the main message for decision makers to be that they take away from this discussion. Stephen Goss, I'll start with you.
Well, I'd like to maintain that very positive approach that the government has mentioned too. It's good that we're all on the same page. We all agree that that this is the way to go and it's achievable. So, in terms of where we go from here, I think it's a question of us all just keeping the pressure up. So if we keep pushing and pointing out to the government in particular that this is not some obscure ask. Not only will it help the environment and climate issue, it will help the government's objectives and goals, and also will do an awful lot to help carers upon which we depend so much. So there's a lot of solutions here to even more problems that are covered by what we're recommending here. So I think it's about time that we try and get the government to listen to us.
Thank you. Stephen Frost, I'll come to you next.
Thanks, Eva. I think for me, you already mentioned the Integrated National Transport Strategy, which was launched with a promise to be people-focused and to kind of iron out many of those issues that people face in trying to kind of juggle public transport with active travel, all of these things. And I think the big one for me coming away from this is it really matters whose needs are being accounted for when you're talking about creating a people first focused strategy, that the voice of those on low incomes, the voice of care workers, the voice of those facing additional barriers to making use of transport systems have to be fundamental to how we approach designing the transport system for the future, both with that climate focus in mind, but also with equity issues and kind of that desire to secure a just transition. So very similar to kind of what Lisa said a moment ago, just keep listening is such an important message, and employers can do that, NHS trusts can do that, government should be doing that to another level to what it's currently kind of achieved, I think.
Thank you so much. And Lisa, any final thoughts?
Yes, actually, now my top ask would be West Streeting keeps talking about local services to fill some of the gaps and also change the way we deliver social care. So my top ask is get on with that and let's have a look at some working models. And the message is you can't not do this, and design around community is sticking in my mind. So
very important message. Thank you. And Gavin, your final thoughts.
I'm particularly drawn to Lisa's urging for us all to get on with it, and I think that's what government should do as well. Specifically from the point of view of what Unison will be doing next, we'll be taking the conclusions and the recommendations of this report directly to government. And again, I think Lisa's suggestion about the government facilitating some proper conversations with care workers about other practical solutions around transport in order to deliver their jobs is a really smart move, and I think maybe we should be pushing government to do that. So there's a couple of kind of actions for us as a union to be taking in order to try and take this work forward. This isn't something that we're going to stick on a shelf somewhere. It's something we're going to use, and we hope will lead to real change in the care sector.
Thank you very much, everyone. I think that's a great note to close on, and I'm sure Union will keep pushing for the reforms that are needed. Unison will be pushing for the reforms needed in the care sector, and us as a charity, this report is not something that will sit on the shelf. For us, we will continue to be pushing ministers, MPs for progress on better transport transition that is accessible for everyone in society and serves the needs of individuals and communities. So just as a final plea for anyone who's able to donate today on the final day of our much funded fundraising effort, please do so. Thank you to everyone who attended and joined this webinar. Thank you to all the speakers, and I hope you have a